There's something about the power of art in healing that has a kind of universal hold.
Decades of research have shown that the arts are a powerful tool to improve lives and promote healing. We are one of the first philanthropies to focus our giving at the intersection of arts and health. Our mission is access and opportunity for all New Yorkers. All people, no matter their zip code or the circumstances of their birth, deserve to experience the transformative power of the arts.
One of our learnings was that different artistic disciplines can function in very different ways in addressing health issues. Films, visual art, theater, storytelling, music, dance, the range of artistic approaches and the range of the issues that they can help with was really striking.
Stigma is one of the main reasons why I started Darkness Rising Project. I was so afraid to reach out for help because I'm Black. Our approach at Darkness Rising is to use joy, and we use that joy through song, and we bring Broadway stars out to a stage, and we sing, and we tell our stories, and we provide free mental health support for everyone.
We are the only mental health nonprofit that provides free therapy session for formerly incarcerated, marginalized communities of color. That is huge.
We're gonna fight against that stigma, and we're gonna find a way to make that therapy possible for people.
Common Threads Project works with survivors of gender-based violence, war, and displacement in places around the world. We train local clinicians, local practitioners to do a very specific intervention so that these survivors can really thrive.
They don't need to share in words what they went through. Participants were able to take control by sewing and creating their own art at their own pace. They're able to process personal narratives through the medium of story cloths. It was just powerful to witness and an emotional moment for me. As a therapist, I had to kind of hold it in and keep composure.
Dance for PD envisions a world where everybody living with Parkinson's has access to transformative dance and music experiences that support their journey with Parkinson's, that help them manage their symptoms, and that help them sustain a quality of life that focuses on dignity, creativity, social interaction, and physical inspiration.
We've really come to a place where we understand the needs of people with dementia, the needs of care partners. We also understand museum education technique. We have knowledge of history of art and art making techniques. So we put this all together, and now we offer this to museums to help them bridge their collections and the types of activities that they mean to be offering to this particular audience.
Art is one of the things that causes awe. Awe is good for people's mental health. Awe makes people enjoy their workplace. Coming to work feeling good about your job makes you a better caretaker. You want happy patients, you need happy doctors, happy nurses, happy social workers.
The Arts and Medicine Department was established with the support of the Laurie M. Tisch Illumination Fund, where Laurie Tisch really saw there was a gap in the public system, and her love of arts contributed to sort of the idea that if we can get into the public health system and support these workforce, we're really going to see some wonderful outcomes.
Our commitment goes far beyond funding. We support our grantees' professional development, convene them for shared learning, facilitate collaboration, and we help them amplify their work.
As the initiative has grown over the years, It's been tremendous, and we actually are now collaborating with some of the other grantees, for instance, running wellness workshops because they were finding some of their staff was getting run down, burnt out during the pandemic, post-pandemic, when all of us had too much to do and not enough hours in the day.
It's shifting the culture and understanding the power of the arts, but it's also shifting the culture in the way that we look at things, ways of understanding, ways of looking, ways of listening.
If we can find new ways to make a case for funding for arts and mental health, we can create real shifts, not only just within our cohort, but at large in terms of our perception of the ways that the arts and mental health interact with one another.
We've been so impressed by the collective power of the grantees. We've seen the momentum build, the strength of programs build, the reach of who they're touching. The collective impact is extraordinary.